Okay, so we are looking at infective endocarditis in children. Infective endocarditis in children. Okay, so endocarditis, of course, if you look at this, inside is the endocardium. That's the muscle of the heart inside. The muscle of the heart outside is what is called the myocardium. So if the myocardium gets inflamed, that's myocarditis. If the endocardium gets inflamed, that's endocarditis. Okay, it's just literal like that. So infective endocarditis in children is a rare but it's a serious infection of the inner muscles of the heart. Okay, that's the endocardium. All right, so typically it involves the heart valves. Okay, so though it is uncommon, if it occurs in children at all, there's a whole lot of risks there, So it's just a bacterial infection. The bacterial infection was elsewhere, but it entered the bloodstream, then eventually got to damage the heart, okay, and all. So risk factors in children. So children are more likely to actually develop it because probably they might have had any congenital heart disease. All right, maybe they have been using prosthetic heart valves. Maybe there's a previous history of endocarditis. Maybe indwelling central venous catheters. Maybe they have any other issue that is making their immune system kind of like not competent. Then rheumatic heart disease and all of that, So you can see this endocarditis. You can see the valve that has been affected by this. It's definitely not competent. Okay. So you have blood flowing inside and you have blood flowing outside of the valve, which is not supposed. Okay, blood flow in the heart is supposed to be one way. So symptoms to watch out for: persistent fever shows you that there's an infection in the blood. So fatigue and malaise, night sweat, weight loss. Okay, heart murmurs, signs of heart failure. All right, then on the skin they can have particles, okay, ulcer nodes, Genway nodes, Genway lesions. Okay, endocarditis. So diagnosis is blood cultures. You want to dictate the infections, echocardiography, complete blood counts. All right, so treatment: you are dealing with an infection, bacterial infection, so you have to actually opt in for antibiotics. All right, then if there's a severe valve damage or the infection is always you have to actually do a surgical intervention for this. Okay, so that's it for infective endocarditis in children.